the meridian and the acupuncture theory works. And so when I poke on the other part of his body, then I ask him, "Oh, okay, now you try your shoulder," and he suddenly so surprised and turn into very scared, panic. And he say, "What's going on? Do you get more hurt or anything happen?" And he goes, "No, the hurt is gone. My shoulder is moving very well. But what did you do to me? Is that any voodoo or black magic? I'm pretty scared. And you have to tell me that I can see he's really panic. Like, I feels like, are you kidding me? Are you really thinking I'm using some black magic on you?" And then he say, "Yeah, but I mean, how can you never touch my shoulder? And then now the pain is gone, and then I can move very well." And I say, "Well, please calm down. And if you want, I can explain to you how does acupuncture works." So
Hi, and welcome to The Holistic Entrepreneur, where we explore innovative approaches to healthcare through conversations with pioneering practitioners. I'm your host, Zane Myers. Let's dive into today's episode. Ready to go. Okay, so tell me, do you prefer Dr. Irene, or is that what you usually go by?
like here, people just call me Dr. Irene. That's what easier for them to pronounce my name. So yeah.
In your practice, so you came, you immigrated from directly from Taiwan, and you have a. So tell me about how you got involved in. So originally you were in regular allopathic medicine in Taiwan, is that right? And that's your training.
Yes, actually, I was training in China. Yeah, so I went to medical school in China and we got trained both. So the modern medicine as well and the traditional Chinese medicine as well. So the MD is once you get graduated from the medical school, you are the MD. And then after I graduated, I went to Macau, so I practiced over there, and then for many years. And then life goes up and down and things happen. So I got married and I had kids there. And when things happen, then I decided, okay, probably it's time to leave. Then I moved back to Taiwan and then take like a two years to prepare everything here. Then once when I got a license here, then I come here. So start my new life again. Yeah.
So how long have you been in the United States?
This is my fourth year.
Your fourth year. Wow. Okay.
Yeah.
So you actually got a license to practice before you came to the US.
Yeah, that's right. Because for the medical field, no matter which country you are, if you want to move to the new country, you always need to get the new license locally. So they don't just transfer license automatically. They do accept the training, like academic background that you got where the country you were, but you have to get the new license in the local country. So that's how I have to do that. Yeah.
So tell me about what I'm so this will be kind of a conversation both about your practice and what you do and your successes and so forth. And but it also be a conversation about how you get patients and then the struggles with starting a practice
Yeah.
and that the emotional part of all that. So I think so we're talking both to potential patients out there as well as other practitioners in holistic healthcare, and really to help them as communicate with potential patients. So as
Yeah,
to
sure.
how you got to where you are. So tell me a little bit about opening your practice.
Okay. So the first 2 years when I got here in the United States, I work as an employee. So because the first because in each country I was being like in China, in Taiwan, and in Macau. So all three different places they have different healthcare system. So the first thing you have to very well know how does those healthcare system working in that local uh, area. So like in the United States, when the first time I got here, I have no idea. I just heard about the people, oh, I have insurance list. And then to me, in my mind, from where I came from, only one health insurance. It's just from the government. So pretty easy and simple. But when I got here, I got like a very I would say a shock, like many time different kind of insurance, and then for all different kind of insurance, they have all different kind of plan, like a coverage plan. So and then have like you have to file the claim, you need to get the reimbursement from the patient or from the insurance company, and this and that, like just overwhelming. So I choose to okay, I have to work as an employee for like a 1 or 2 years, and then to totally understand how does this healthcare system work. And by that moment, then I understand. Well, it also helped me to get understand more how does these people here how they see the holistic integrated medicine, how they see acupuncture. So once I get to know to talk to the patient in the first 1 or 2 years I talk to them a lot. I ask them their opinions. I say, hey, how you see the acupuncture? Do you see them really work? Because the most of the time when those practitioners they are um they are waiting for the patient ask them questions, right? Like if some patient they have many different kinds. Some patients they are really interested in a holistic way. So they want to know how does this work, what should I expect it and how long it will take, and do I need to prepare anything to come to see you? This and that. Those are patients they have a lot of like, curiosity to about, oh, this is a new thing, then they are excited to explore about the experience. The other patient is, oh, I never know about the acupuncture. This is my first time. I just want to people try to see if it helps. I'll say, right now, probably 60% the patient I got is this kind, the second kind. So, oh, this is my first time. I don't know how it works. I just want to see if it's helped me. Then in that case, you need to it's kind of, I won't say bait, but it's kind of you need to fishing it, you need to give them something interesting to bring up their curiosity, and then to see if they are really interested in this way. Otherwise, they will just come in for the first time and they don't know what happened. They don't know how to expect it, the result, and they will just leave for the very first time and you will never get them back. So I learned that from my first year here. So I learned to maybe we shouldn't just wait until the patient asks us. So we can ask them. So okay, so how much do you know about acupuncture? Do you want me to share any information or educate you any knowledge about the background, or why what brings you here? Like, do you refer by a friend or you just Google to see this will help you? So you will try to get the information from them to see how much they understood. So by that case, by that point, then you have more idea and will know how to tell them to give them more perspective. Like says, oh, okay, so acupuncture is not just for pain management. I'll say 90% of the United States people, all they understand is, oh, acupuncture only help for the pain management. I say, no, that is not right. We do everything. We just don't do surgery. If you break your bones, like rupture out of the skin, I cannot help you. But other than that, we do everything from the cancer care, from the unhealed like chronic wound, or from like a chronic illness like diabetes, high blood pressure, or especially those stroke, neuropathy, those kind of things. Acupuncture helps so well, much better than you take the medication for your lifetime. Those actually, they are not, I won't say they are not helping you. They do have like a short-term help. They will control the symptoms, but they actually like chronic killing you sooner, than you don't do anything else. So that is my way to try to talk to patient, try to understand them, what's their stand, and then try to get them into have more interested into the acupuncture.
So if they don't understand, or if they just come in for one visit and they don't really understand what's going on, and
Yeah.
then they don't have immediate results, then it's really hard to get them to be a return patient. I'm getting that out of this. Is that accurate?
Yeah, the most of the time like that, but I would say it depends on what kind of condition they came to visit me. So the most of the condition to me is very easy to fix. So I will tell them, okay, for this one, probably the first time, then you will have like a 50% relief. Then when they see the relief immediately, they will say, wow, it's amazing. And then I will tell them, okay, so you have to know you got this percentage relief now, but it may come back tomorrow. So after that, for the first 2 weeks, I always tell them we should keep the treatments more close. That's how we can bring your uncomfortable down to the certain level, then it's manageable. After that, we can do once a week or once every 2 weeks, and depends on your schedule. But now, if you really want to have like time free, or want to your your discomfort like become manageable, then yeah, this is our treatment plan. Then please just follow that. And then most of the patient, when they receive that kind of relief from the first visit, they compromise it very well. Yeah, they cooperated very well. So that's yeah, that is how I make men to keep coming back and then follow
So is
my
most of
treatment plan.
are most patients, experiencing some sort of pain, or, versus, you have, I went through your site and it was interesting. I found it interesting because I don't think of acupuncture for all of these different things, but I'm not really educated in, Chinese medicine as
Yeah.
much. But, hormone imbalance, cancer, infertility, um, neuropathy, joint injuries, pain management, so many different things that you're, addressing. Can you tell me maybe one story that kind of stands out to you about a patient who came in with something really bad going on and you saw some results?
Yeah, sure. Uh, let's start with okay. Let's start with the Bell's palsy and the stroke. So, they are two very similar case. So one case is I have a stroke patient. He was like a professional sport player. So they play sports. So the body motion, the those activities are really important to them. So when they have stroke, it's kind of like a half side of the body paralyzed. So they won't be able. So basically, if they don't cheat, their career just done.
Yes.
And so, but he came to me immediately. So I told him, okay, I have for this kind of stuff, I have to do very traditional way, which is I have to be honest with you, it's very brutal. I have to see him in tears every single time, but every time he can see a lot, huge improvement. So for his like neuropathy doctor, he also very surprised because he said, "Oh, I didn't expect you to recover in 11 months, but you got everything back to almost normal just in 7 weeks." He's so surprising that he recovered in that short time and then recovering so well. So he basically back to play and practice his sport in just 2 months. So that is a very encouraging story. And then the
Yeah.
other one is like a Bell's palsy that happens a lot, very common in the United States. And then people always wait until like a 2 months, 3 months, then come to the acupuncture, which that is totally what we call like a golden time that you can repair your nerve can get repair or recovering well. The another case is he got the Bell's palsy a day before he came to see me. The next day, he came to me immediately and said, "Oh, I got a Bell palsy and you have to help me." So his half face got totally numb, won't be able to move, and it looks weird and funny to people. And I said, okay, no problem. But, for this kind of stuff, you have to come every day, every single day. And then he pretty much the same brutal treatment. I have to do very traditional way, stimulate the point and make sure everything start working and the points receive the signal, they have some reaction. That's how it will start to work. And then he said, he don't care. He I just need to do whatever I need to do. He will take it. He will handle that. So I saw those big, tall men always in tears on my table. And then but in the end, they are so happy. So for that healthy patient, that he got a completely like 100% recovered, and then there's no any side effect left in just 1 month. So
Wow.
30 days. Yeah. So usually the Bell's palsy, they take 7 months or 10 months to recover. And most of the patients, they still have like a 10 or 20% left. And some of the patients, they got like forever lifetime impact. I would say for those neuropathies, illness or disease, time is matter. Don't waste the time to I won't say don't listen to doctor, because those modern medicine doctor, the only thing they know, the only way they know is, oh, you just wait until a year, then your nerve system will coming back slowly, and then this and that. The truth is, on the other side, we have better way to help you to recover your nerve system in a much short time, and then can help them recovering completely. I would say sometimes don't wait, even though you have hesitated to see, I don't know if this can help me, but no harm. After you try, if it doesn't help, then still you have to wait until a year. There is no harm. But why you waste this golden repair time and then after a year when you come back, then I will tell you, I'm sorry, there's nothing I can do because it's too late. There's something like that.
Wow. So do you have a hard time getting referrals from physicians because they don't, they see your practice as something less than, you know, that it's
Yeah.
not regular allopathic medicine, so they're very skeptical. Does that
Yes.
happen?
Yes. Well, not just from the physicians, also I heard like a few funny story. One is from physician, one is from my other patients. So I'll start with my one of my patients. That he's a guy that he come in and then he said, "Oh, I have a shoulder pain." But the traditional acupuncture, we don't just treat local. So if your shoulder pain, we don't poke your shoulder. We poke the other place. And that is how the meridian and acupuncture theory works. And so when I poke on the other part of his body, then I ask him, oh, okay, now you try your shoulder. And he suddenly so surprised, and turn into very scared, panic. And he say, "What's going on? Do you get more hurt, or anything happen?" And he goes, "No, the hurt is gone. My shoulder is moving very well. But what did you do to me? Is that any voodoo or black magic? I'm pretty scared, and you have to tell me that I can see he's really panic. Like, I feels like, are you kidding me? Are you really thinking I'm using some black magic on you?" And then he said, "Yeah, but I mean, how can you never touch my shoulder? And then now the pain is gone, and then I can move very well." And I said, "Well, please calm down. And if you want, I can explain to you how does acupuncture works, so you can see this result." And then he said, "Okay." So after I explaining how does acupuncture work, and then what do I do, and then what is the whole meaning behind those points, then he start to get idea to see, okay, why his shoulder can move that, uh can be pain free, and then back get the range of motion back so soon. And then he start to feel okay, kind of like a safe. And then before he left, he still want to make sure I didn't use any curse on me. I said, "No, I'm not a witch or anything like that. If I have that kind of superpower, I will just use on myself and make me, much, much stronger or much powerful." So I said, I just overthinking. I don't have that kind of power. Yeah.
That's an interesting story and kind of fun that you had that kind of an impact immediately and someone
Yeah.
could, that's really quite a remarkable story. So
Yeah.
how do you get patients in? So seeing in the United States, acupuncture, although I was surprised, I looked up that out of all the alternative healthcare specialties, I saw a recent study that said acupuncture as one of the is the largest single category of alternative healthcare in the United States, the largest practice single category. More people do that than any other category except for chiropractic, which was surprising to me. I thought it would maybe naturopaths or something else, but it was acupuncture. So, but there's so many people who still see it as pseudoscience, even though it's been
Mhm.
around for centuries.
Yeah.
How do you deal with that to get people to come into you? Do you advertise or do you have a referral network or what do you do to get people, to say, "Oh, Dr. Irene, you got to go there."
Yeah, so from the very start, I'll say word by mouth is the best way. And the second is I did a lot of like advertising, like from the Google, or I joined some like a network resources like a BNI group, or I joined some like um kind of like a commercial or business networking group, like weekly. But for those kind of stuff, I don't see that much efficiency. They in the initial, like very beginning, they will bring some people to you. They just try to help you, support you when your business gets start going. And I really appreciate that, but they are not really interested in acupuncture. They just, oh yeah, welcome to our group, and then you just get right started, and then we want to support you, you're part of us, and that's really good. Like I think it happens in every way that if you are not interested in it, it won't last long. So you have to find those people who are interested in acupuncture and they really need it and they really want it, and then to make sure you are a good match. So like a lot of patients, when they came to me, they say, oh, they feel I'm very calm and then very like well known, like how to about my knowledge. Like I'm very knowledgeable, and they can ask me most like all kind of question what they about their health, about their what should they do during their daily life, and what should they do for this and that. Then I don't mind to tell them all those advice or from my personal opinion or experience. So I think you have to let people know that you're willing to help them, not just a business. So I see my career is part of my life, not just coming up like, oh, I have to wake up today, I have to go to work and then for like 10 hours work and then go home so late and tired. I don't see my business that way. I wake up every day and then I feel very energized. I say, oh, I have this many people that I have to help today. And then every day when I get to into the office, when I waiting for them to come in, I'm very expecting to visit to see them, and then they also every time they will give me some really good news and feedback. Like I have another patient which just happened yesterday. Right when she came in, and then life goes on, and you have like a good time and a bad time. And it's just said I had a bad moment at yesterday. And I was just kind of a little bit frustrated. But when she came in, she said, "Oh, do you want some good news?" Then I say, "Yeah, sure. Show me what is the good news." Because before she came to see me, her blood test is all red. Well, I won't say all red is too crazy, but the most of the major items are red. Like really bad, all those indicators are too high. And then she says, see, I just got my new blood test done. And then my physician surprised as well. She says, how does this possible? All those numbers are back to normal. And then she didn't take any medication. She just made a commitment and she came to me 3 times a week. And then after 5 months, and all those red mark is all back down to normal, like liver functions and the immunity, the inflammation, all those things are gone and then back to the normal. Then she's so happy. Then she said, I could show everyone I know that my blood work, my blood tested, they're so normal now. And I told everyone about you and this and that. So that's how I get my patient. This all the most of that is word by mouth. So they refer their friend and their family, their anyone they know. If they see, oh, you have this problem, you have that problem, they say, just go to see Irene. She can help you. Just go to see her. She can help you. So I would say, put your passion into this acupuncture is much important than you just see it is a job. You know, yeah.
So what would you say to somebody who is starting out? So when you started 2 years ago, well, or I mean 4 years ago, but really your practice you started 2 years ago. How long did it take before your schedule started to, get more full? So you must have pulled some patients over from when you were working for another entity, and they kind of just went with you, I'm sure. But you probably had a lot of open spots in your in
Yes.
calendar, which is
Mhm.
kind of scary. I would
Yes,
think, as a
for
business
sure.
person, you're a business person and you're, a caregiver. So it's the combination of the two. What would you say to somebody starting out? What would you say? Okay, this is how I did it, and this is how you could probably do it as well. Starting from your practice, really from scratch.
Okay. So yeah, I'll say because those non-compete rules. So when I start my own clinic, I just very far away from my original workplace. So I was trying to say, hey, if you really, like my skills, and then we have a very good treatment time, then yeah, I have not right now I have a new start, and then yeah, you can come over this and that, but that doesn't work. Yeah, I will be honest with you, that doesn't work. People they willing to try everything. Well, I won't say this way. People they're willing to do acupuncture with me, but it have to based on their convenience, you know. So if you move out very far away, like 30 miles away, they it's very rare they won't just drive that far and spend like a 2 or even 3 hours on a commute to visit you for not for those not life-threatening illness.
Yes.
So yeah, it's not just not reality. So I realized that after the first month I tried, and I said, "Oh, okay, this doesn't work." So I have to discover the new patient locally.
So how was your
Where I have
stress during that period? How was your stress? As far as you're thinking, oh, what I thought was going to happen didn't happen. Now what do I
yeah.
do?
Yeah,
Was
that
that
is
kind of
yeah, very good question. So the first thing you have to set a very solid mindset, because I tell myself, if I have to or rely on my old patient to support me to get my business going, I I will fall one day because it means I won't be able to get any new patient, and I don't have that ability. But which I know I can. I just need to put my name out there. So after that month, I start to put my business on the Google to increase my visibility, and then to also from the first year I got here, I start to build my reputation, which is the reviews and the word by mouth, and then collect those, I'll say, stay in touch with those patients. So when I moved out, then I tell them, oh, I am here now. If you have any friends or any people like around here that need my help, then I would love to help them. Or you just feel free to share my information. And then the very beginning, the most patient I got is from Google, actually. I would say the Google helps a lot. So the most of people, they still searching like, oh, acupuncture Bellevue or acupuncture this and that. And my name just pop up. And of course, you have to pay for Google, the sponsor, to
Right.
put your name on the top. That is for sure. But once you get a certain traffic, then you, if you have that ability to keep them, then they will just rolling like the snowball, getting bigger and sooner. So I'll say take every patient seriously. Don't just you have to let them know that you are truly care about their health. It's not just, oh, I need business, so please come to me. That doesn't work. You have to treat your heart and your care to show them this is what I can offer you. And then all those upfront, I want you to getting better. Then they will follow your instructions. They will accept your treatment, and then they will trust you. So I think the best thing is you have to let your patient trust you and then believe that you can make them better, and they will tell everyone. So for like right now, I have another family patient. They're so cute. They're adorable. So the first time is the daughter came to me. Her dad brings she here, and then she for the lower back pain. And after one session, the pain was just gone. And then she felt, oh my god, it's so amazing. And then I said, okay, it's okay, just one time, and then maybe I'll see you in 2 weeks because she just like mild, like a muscle torn. It's not a big issue, and she was young. So, but when she go back home, her dad called me again. I said, "Oh, what's going on?" And she said, "Oh, no, 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 just I want to make an appointment with you, and my wife also want to have an appointment with you, and my other daughter want to have an appointment with you. So you're like a whole family become my patient." That is how I get my schedule booked full so quickly because once, if the one patient they see a huge difference just in short session, and then you're not like other acupuncture, like keep asking them to coming back after 6 or 10 times they didn't see any different, then yeah, they won't refer people to you. Then your schedule will just get stuck. So that's how I build up my business. Actually, my friends and my family are so surprised. Right now, be honest, until today, it's not even a year for on my own place. So I build it up pretty much on the second month or third month. It's just even. Then after that, I just gradually increase the number, and then everything just get better and better.
So your practice now, I see that you have somebody else practicing with you. Are they like a actual business partner or uh, um, part of your practice? She's a naturopath.
Yeah, she's a naturopath. So for her, because like I do have the medical training background. So if my patient need, I will give them like a both side perspective. So okay, for the modern medicine, you have this, and probably the treatment here will be like this easy, and then this you need to take this long time. Then from the acupuncture, the traditional Chinese medicine side, you have, we see these kind of symptoms because of this ABC. How to say that? Because of this cost or this lifestyle, and whatever the reason is, then we need to treat you like this way. But also for some condition, I would say like a diabetes or high blood pressure, those kind of like chronic issue, they cannot stop medication immediately. So I would let them know that if you want me work on that, we are good. We can gradually bring the dosage down from time to time after the certain months, and then when we check your numbers and if the glucose is good and this and that. But I will need, I will also need you to see my another doctor to be to have a consultation, make sure you are safe to lower down the dose. So that's how we can one day we can make you like um pill free. You don't need to take those metformin or the other medication lifetime. No, there's nothing you need to take for lifetime. If you willing start to make any change and then follow those instructions, you have very high percentage that you can live like a medicine free. So that's how I need somebody on the side to help me help those patients to reduce those medication or even they need something help for like acute situation. So that's how I work with her together.
So are you looking to grow your practice from where you are, or you just like to kind of keep it where it is and keep your life manageable? And what where are you looking to take your practice from where you are now? Are you just happy with the way that it is and you just want to continue on? Is that the goal, or do you want to make it something much bigger?
Yes, well, that is very interesting question. Actually, I was just thinking about that lately. Well, for me, definitely, I love to help people doing the acupuncture. It's my career. It's part of my life. But also, when I see the whole um, healthcare system in the United States, it's very frustrated. The whole system is collapsed. The
Yeah, I see a
physician
lot
and
of I agree. I see a lot of obesity and just general. There's a lot of things that are our healthcare system. We're all about fixing things after they've already, went bad.
yes, and also um the modern medicine training education or physician training here, that is what I heard from my patient. They say most doctor they just don't listen. They just tell you what do you need to do, take these many pills, then see you in a month. I say, what? And then the most of the time, um, they just they don't even know what will you be able to do that or not. They just keep giving you the pills or when they see you in a month, if nothing changes, they give you double dose. Then the pills just added on another one another. In the end, they have like a bunch of the pills in their hand, and then they have to take like 2 times a day, 3 times a day. Sometimes when I saw their medication, I feel like, do you have any room for your stomach for food? The real food. They like really, I'm not kidding you, like really handful, like plenty, like 20 or 30, all different kind of pills every day. I just feel, do you really think that will help your health? And then not the other way, like chronic killing it, make you more toxic. And they say, I don't know. Those just the doctor tell me, oh, I have to take this, I have to take that, and then plus the medication. If this hurts my liver, I have to take another medication to protect this, and then to prevent these kind of things happen. So on and on and on. Then they just nonstop pills, medications, and then I feels like I saw there's a lot of like hospital here, but they all are modern medicine. Those the surgery like just the medicine how to say that the Western medicine hospital. But there's no one hospital is for holistic only. Like holistic way. We are not just acupuncture or chiropractor or naturopath. Actually, I Google it. We have like a 13 or 18 different kind of provider
Yes.
categories for the holistic um, medicine. So I was thinking about maybe we can do something better, like have a real like a hospital size and then put all these different kind of providers in there. And then when people get in, they can get a very convenience from one stop to another. Then they don't need to commute, and they can get a like a full service, like a PT or chiro, acupuncture, massage, or naturopath, or even like a um all the other kind. So yeah, I was thinking about that. That maybe is a very good idea and then doable. And then also combine the insurance, they can be very powerful. Yeah.
So what do you do about that? I wanted to get around to that. So I'm glad you brought that up with the insurance. So I know that acupuncture is starting to be covered a little bit more with insurance than it has been in the past, but I think it's probably specific to the condition that you're treating. How do you deal with the insurance issue?
Yes. Oh, that is another pain. Yes. To be honest. Those so with those insurance, the first communication with patient is very important. And then you have to bring it up ahead before the treatment start. So you have to let them know I take your insurance, which is really good. And then you have to understand if you have any copay or co-insurance or deductible you have to make, which if that doesn't happen, you are 100% responsibility for all the bill. If they say, okay, they understand and they can check that, then I say, okay, we can start a treatment. Otherwise, they will just say, okay, I'll just go cash pay or package then save all those trauma and the issue. I say, okay, no problem. So that is the thing. For the insurance company, it's because the healthcare system in India is really complicated. They're not just too many. They are complicated. They have PPO, they have HMO, and it depends on the age. They have Medicaid, Medicare. They all have different coverage and different plan and different requirements. Some of them, like HMO patient, they need other provider referral later, so you can take them. And then most of PPO patient, they are free to see any provider they like in the network. But still, after they used up all those coverages, then they have to figure out if they still want to continue the treatment or do the maintenance for their health. Then they have to be paid out of pocket because those visit limits are really, really not enough, especially for the long-term care, like chronic care. One thing that acupuncture can do much better and very well than the Western medicine is we can do the preventive um, health care. So like if you have nothing going on, you don't have any issue, you think you are quite a healthy person, you still can do like a once a week or once a month acupuncture just to do the maintenance, just to do the prevent the further or any kind of illness that's going to happen in the future. So like the most of people they don't have that idea is I'll say like a 90% or 99% of the people right now, they all are in the sub health conditions.
There's something going on that they need to address.
Yes, there's something going on, but they don't understand or they don't realize that. So they wait until the very serious condition coming up. They say, oh, I'm sick now. Then I have to go to a doctor. Then they have to spend a lot of money and to take the medication, do the surgery, take the CT, MRI, all kind of examination. But if they can just take care of themselves from day by day or week by week, month by month, all those mild conditions, they can be treated. It's very treatable. It's very manageable, just from once a month or once a week, then you just spend like a small amount of money and can prevent you from like huge surgery or long-term medication, those kind of stuff.
So how do you manage like all the insurance companies and all the requirements and the paperwork. And do you have somebody who specifically does that for you, or a company does that for you? Or, I mean, I would imagine that's a lot of hours.
Yes, so that is what I'm struggling right now. I don't think I am busy enough to hire another people to help me right now. So basically, I did everything by myself on my own,
Mhm.
and I have to take like one day extra, one day like in 2 weeks to do all those paperwork, to do those like EHR, to do the claims, to check, to track the payment, and to yeah do everything. And those are really really um those are really a little bit too much because each insurance they have different code that they do accept. And then some insurance they don't accept this kind of code. Some insurance they do, and then with different units and then different numbers. So those things you have to um I would just say you have to organize them very well. You have to list out a bunch of lists. Okay, so regions they take this, and that. Aetna they take this, and that. And the Kaiser they take all different kind and put it on your list. So when you need to building do those kind of things, you have like a full picture to know what you are dealing with and how you can do that. So and if you do have I do have a advice for the other providers. If they have that ability to hire people to do that for them, which is great, wonderful, but they still need to learn how to do that by themselves. Just like if you open a restaurant, you hire a chef to do all the cook for you. As the owner, I would say you have to know how to make the same recipe once when the chef leave. So like for me, I need to even one day I have that ability, I can hire people to do those stuff for me. I still willing to learn how does those things going and then how to make it correct. So when I look them to do their job, I will know if they did it correct or there's something they need to adjustment. Then that is better than when things goes wrong. Then insurance will give you the feedback. Say, oh, we deny this, we deny that, we don't pay this, we don't pay that, and you have to do all the track back to the date of the service and the all those claim number and then refile again. That is another whole trauma. So for saving your time and those work hours, you just need to learn how how all the building process doing, and then you you learn it very well. Yeah, that is my advice.
So do you still do advertising, or is it all word of mouth now? Do you still do Google or Facebook or whatever, some kind of advertising that, or do you just
Yes, I do. I still do Google advertising and the word by mouth, and also I'm thinking about do some like Facebook advertising. Because I'm thinking right now, due to those economic crisis situation, a lot of people got laid off, so they probably won't be able to afford the treatment like for long term. If they want to. So I'm thinking about to get some like lessons, like an online lesson. It's very cheap. They can just download and then watch the video. It's kind of like education to them how to keep their lifestyle stay easy, healthy, manageable, stay away from the illness. So in that case, people can have like well known about holistic medicine and then how to take care of their body, how to take care of their health from the daily life base and the diet program or um just their schedule. So that is my idea that yeah, I'm still doing that, and I want to do it more to help more people, to get the people know acupuncture or traditional Chinese medicine much more.
So, what would you say to someone who is thinking of going into a career in acupuncture? What advice would you give to them?
Okay, so my advice is um, the first, I would say the textbook, what you learn from the school, I would say it's not that much different from what I learned in China. Actually, I would say the textbook in the American that the school they use much more detail because I study for the both version. But I say in the English version they are much detailed, but try to understand the the background theory that the whole Chinese yin and yang theory, the universal balance theory. That is the thing to make me differentiation than American providers because the knowledge is very easy to learn. You just need to memorize all the points, this and that, and then what's the combination. But the whole theory and then some special technique, they um you need to put that idea in your mind. So when you use it, when you practice it, you will know where it came from and how to make it work. So the most American acupuncture providers, they just know the points, but they don't know how does it work or what's the meaning behind it. So they just follow the textbook. Okay, for lower back pain, put this and that, but they don't understand how to make it work. Acupuncture is not just put the needle into your body, then just your body just like a pin cushion. Then everybody can poke a needle in and anywhere. Then you were expecting to start have some work. Then that's not happen. That's not going to happen. You have to make sure the point receive your signal, they start working, they get triggered, then that's how your patient will get better in very, very short time to see the result immediately most of the time. Then that's how you can earn those trust and then patient they can know they can rely on you. So I'll say for those kind of theory and idea, it's to be as an Asian, that is my benefit because it's in our blood and I grew up from there. So we know that kind of theory since we are really, really young. So it's kind of very natural to us. And but for people who born and grew up here, they it's it looks feels like they have the kind of struggle time to understand that kind of stuff. So they just focus on the words. They just focus on the textbooks, but they forget what's the whole thing, the whole theory, the whole story behind it. So I'll say try to understand that and then make it in as a part of you, not just acupuncture. It's different. Yeah.
So, I'm about ready to wind things up. It looks like you're still having fun, which is, I think, really makes a difference in anybody's practice if you really enjoy what you're doing and you really feel like you are helping people. It's
Yeah.
it's it's a much you get much better results with that, and it looks like you're still really enjoying what you're doing. I'm glad to see that.
Yes. Yes.
So, I know what else I was going to ask you. So, when you're working with your patients, how much of your personal side do you share with your patients? I mean, as far as them getting to know you as a person, is that important, or do you? Because some people have different philosophies about that. Some people like to share and really let people into their personal life, or get very personal with people. Others feel like, well, I want to keep this a certain distance between me and my patients. This is kind of a parting question, but I'm just curious. Personally, I'm curious.
Yeah. So for me, I would see what kind of people you are. Definitely, some patients they don't like to talk. They don't like to share. Then I'll just keep silence. Then I respect that. But some patients, if you can see they are in the life struggle, they are struggling with the life situation. And for me, be honest, I immigrate from one side of the world to another, and then throwing, the marriage, the life, the kids, and then everything. I think I've been dealing a lot, and I've been through a lot. And then I'm still here and stay positive, have like that upwards energy, and still, I would say most of the time I'm happy every day. Yeah, I'm very positive. So I don't mind to share that kind of mindset and positive energy to patient to let them know this is not the end. Sometimes you don't need to share very detailed. You just need them know I was been there. And then this is not the end of the world. And then your life can getting better. Everything just a short term. Once when the darkness gone, you will see the sunshine. And then sometimes when you are in low, and it's actually a perfect time for you to take a pause for your life, that you can review the whole thing and then to reconsider what you're going to do the next. You don't need to push your life too hard. And then most of patients, they have like anxious, very depressed, and then they completely losing the hope in their life. In that case, you just need to let them know everything that they are struggling on right now, it's not important. They are important to you because you are still here. One day when you're gone, nothing is important. That is very, very important life guidance to me as well. To then they feel a lot helpful from that because when I was an intern, a residency in the medical school, we saw the baby births, the people dying a lot. Then you will understand what the life meaning, the real meaning is. It's not about the end or what the result that you get. It's about the whole journey. Do you enjoy every single day and every moment, or do you accept that everything happens in your life, no matter high or low, bad or good? If you can enjoy every moment, you have no regret to live your life a- as take it every day as your last day. Then you have a wonderful, no regret, complete life. You don't need to wait until you're 70, 80, and think, oh, I should do this when I was young, or I should do that by that in that time, at that moment. You don't life won't wait. Life won't wait until you're 80 and 90. They say, oh, I can give another chance to try this way, to try that way. No, it doesn't work that way. So every time when they face their frustrated, the struggle in their life, I just tell them it's not the end. And then even though it's bad, just accept that. And once you accept everything happen, you will see the chance where is the another door. Then you can find a way out. That is how the life journey and the lesson to you. So just don't give up. Yeah. That is how I share the most of the time I share with my patient because you can feel them they are really desperate, they are really frustrated, they feels like hopeless, you know, and but they trying to living better. So you just need to let them know it's not the end of your life and tomorrow always comes. Yeah.
Well, thank you, Irene. That was really a nice ending. I really appreciate that. That was great. Well, that about winds it up for today. Thanks for tuning in to The Holistic Entrepreneur. I'm Zane Myers. If you enjoyed this episode, subscribe to our podcast or watch on YouTube. Join us next time as we continue to explore both the art of healing and the science of business in healthcare. We'll see you next time.